Hi everybody.
Hi everybody.
We're just waiting for a few more people to check in before we begin. I hope everybody is staying well and hopefully getting out to enjoy some sunshine today after a rainy, cool weekend. So just give it a few more minutes and feel free to comment, post, like, thumbs, hearts, whatever you like. We love looking at all the feedback after.
And if you guys have any suggestions on areas of the body or issues that are of concern at home that you may be dealing with, we'd be happy to make them part of the seminar series. So we're just putting out, issues that maybe you're dealing with at home that we're kind of dealing with here in the clinic that are something that we can help at home. But if you guys are having issues at home that you want to talk about at a public venue that are safe to communicate with, then we'd be happy to put something together for you, okay?
That's a good point, because now that many of us are working from home, it may not be the ideal setup, and we could be incurring some other injuries or other problems that we've not had before, and you may be wondering what to do about it. So, and this is partly why we're talking about this topic today.
Yeah, and part of that too is our new platform with Gravenhurst Chiropractic is a virtual care platform. You're probably seeing your medical doctors using it, your medical specialists, physiotherapists. I don't think dentistry can get into that because it's hard to do dentistry virtually. But anyway, the virtual care is a good use when we can't be here in person. You would actually go online with our Jane app through our website, book a consultation, and that way we can talk about your condition at home, whatever you're dealing with, and give you timely advice and techniques and things you can do at home to help yourself. Okay, so feel free to look at that on the website. It's our virtual care platform.
So we'll get started. And today, welcome to episode 3 of Healthy at Home. Today we're featuring the elbow, as you probably guessed by my decorative tape. So the elbow, as you know, is the linkage between your shoulder and your wrist and your hand. Now, the unique thing about the elbow is it's a hinge joint. It's not a whole lot of movement at the elbow. We can go this way, flexion and extension. We can go this way, pronation and supination. And that's about it for the elbow. We've got certain number of muscles that go through the elbow. We've got the flexor muscles, which run along the inside of the arm. We've got the extensor muscles, which run along the outside of the arm. And there's also 3 important nerves that traverse through the elbow joint. On the inside, we've got the ulnar nerve, which goes through the inside of your elbow and down the side of your arm here. Many of you may know that as the funny bone feeling. We've got the median nerve, which runs centrally through the midline of the forearm down to the fingertips, and some of you may also know this as the carpal tunnel feeling. And then we have the radial nerve, which runs down the outside center part of your backside of your forearm. So we've got lots of muscles, we've got lots of joints. So there's a couple of distinct differences between children and adults when it comes to elbow injuries. So for children typically have a very common type of injury, which is a fall on an outstretched hand, and what typically happens is a fracture of the elbow. Unfortunately, we have firsthand experience with this with our oldest child who did this very thing a few years ago. Unfortunately, it did result in a fracture. There's also another type of elbow injury that is very common more among younger kids, and that's a traction type of injury that happens at the elbow. And that usually happens when kids are swung or being pulled, usually by adults or parents that are swinging by their forearms, and they end up having a traction type of injury at the elbow joint. Now, adults are quite a bit different. When adults come into the clinic, it's typically not a result of a fracture so much as it's usually the number one cause is repetitive strain or overuse injuries. And what happens is we've got these flexor muscles which turn into a tendon and they insert at this part of the arm. This would be called golfer's elbow. We've got this muscle here, which inserts at this bony part here on the outside of the elbow. This is called tennis elbow. These are the most common repetitive strain overuse injuries in the adult elbow. Now, they call this tennis elbow because, I guess years ago, they realized that a lot of tennis players were developing elbow pain in this very spot. And with a lot of research, they determined it was a poor form in the backhand motion that resulted in this problem at the elbow. Now, despite being called tennis elbow, you don't have to be a tennis player to have tennis elbow. In fact, many of you probably watching right now, working from home, may be experiencing pain in this very location, And that's because of one big offender that a lot of us are doing right now working from home, usually on our laptops, maybe on the couch, maybe at the dining room table, and that's repetitive strain here created by typing usually or texting. And these repetitive actions of the fingers held in this position can create tennis elbow. So what exactly is tennis elbow? Tennis elbow occurs when we've got micro tearing that happens right where the tendon inserts at the bone. And when this micro tearing happens time and time again, it develops a pocket of inflammation. This inflammation will then lead to pain and soreness and dysfunction. Some people report getting weak in their hands or getting weak in their grip, maybe unable to lift the coffee cup or the kettle. So this is a common problem that a lot of us are experiencing, especially now working from home. So if you were in clinic, what would we do to help you? Well, we would do some ultrasound perhaps to help break down the adhesions surrounding that joint. We might do acupuncture to help the nerves and the muscles create more blood flow to the area. We could do shockwave therapy to do the same thing, break down those adhesions. We could do some cross-friction massage in that area where the tendon joins the bone. And you can also see we would apply some rock tape. So this rock tape here attaches to the skin, lifts the skin from the underlying fascia to allow more blood flow, more movement, and smooth gliding of the structures beneath, therefore enhancing the healing process. So those are some things that we would do in clinic. So what is one to do at home when you're left to your own devices? Well, there's actually a number of things that you can do. We can guide you on some stretching exercises to help stretch those muscles into a graded sort of resisted strengthening, and then into more intense strengthening to help build up that area in the surrounding joints. But what about the ice versus heat debate? That's a hot topic that Dr. Mike's going to tackle.
So a lot of times in clinic, we have patients always ask us, when should I apply ice and when should I apply heat when I have an injury? Well, the rule of thumb here is that we use ice when the injury is acute or the pain is severe. So generally that would be in the first 72 hours of an injury, we want to apply ice. The reason we do that is to slow blood flow to the area so we decrease the inflammatory chemicals going into it, and also to numb the pain fibers so we can decrease the nerve pain. Okay, so we would do that by taking a wet tea towel, we would put it against the skin, and then we would put a ice pack. You can use a gel pack or a Ziploc bag full of ice cubes. We want to put the tea towel there so we don't burn the skin with the ice. So the protocol to do this is very, very important. It needs to be 10 minutes on of ice, 10 minutes off, 10 minutes on, 10 minutes off. It has to happen 3 times so we actually get that nerve to calm down and we restrict that blood flow in the acute phase, which is the first 3 days or 72 hours. After 72 hours, in the subacute phase, is when we'd want to go with heat. So with heat, we can either use a beanbag in the microwave, or you can use a hot pack like a water bottle or any moist heat that you have, and you would apply it to the area for about 20 minutes. So you would start to use heat when you want to induce healing. So you want to open up the blood flow now to allow oxygen to come in and to circulate out those inflammatory metabolites. Very, very important for healing. Both of these protocols can be done twice a day. So remember, the icing is 10 on, 10 off 3 times, and the heat would be 20 minutes of a heat pack on twice a day.
So those are some great things to keep in mind. In addition to that, let's walk through what you could do at home with simple things to help stretch the area to start with. So to begin, to stretch the muscles of the forearm, if we're dealing with tennis elbow, we're going to start by extending your forearm, dropping your fingers to the floor, using your other hand just to gently guide and direct those fingers a little closer to the floor. You should feel a pull through that tendon, many of those tendons through the forearm. You're going to hold that for about 20 seconds, and you're going to do that about 4 times. Feel free to do the other side as well. It's important to get a sense of balance and get a sense of how the other side's doing in relation to the sore side. Never hurts to stretch it out. Then, assuming the same position, we're simply going to bend the elbow, and again, assisting with the other hand, we're going to stretch those extensors in this fashion as well. Again, 20 seconds, about four different times. So after we've stretched those extensor muscles, now we're going to get into those other movements that we talked about earlier, the pronation and supination. So to work those, we're simply going to extend our arms in front of us, shoulder height. We're going to interlace our fingers, and we're going to alternate palms up with palms down. We're going to do about 20 of those back and forth to help work those rotational muscles of the forearms. Now, once we've done the stretching, we're ready to progress or move on into some more resisted exercises. We're simply going to start by using the resistance of our other hand. So again, assuming the same position, fingertips to the floor, straight forearm, we're going to make a fist. Now we're going to apply a little bit of resistance against that wrist. We're going to try and move it up, but we're stopping it with our other hand. We're going to resist that for about 4 seconds, 4 to 5 seconds, and then relax. And then again, and we're going to do about 8 of these, and relaxing. Now we also want to strengthen the other parts that surround those joints. So this is your elbow joint, the next joint above is your shoulder, and the next below is your wrist. We want to use the other major muscles to strengthen and support that joint. So what we're going to do is we're going to use a water bottle, or if you have a free weight, 1 to 2 pounds max. We're not looking for heavy weights for these. This is simply meant to help protect and stabilize, not for brute strength, and we don't want to irritate what we've already stretched. So you can either use a water bottle, a hand weight, or a resistance band, something like this. Now this one has built-in loops for easier gripping, which in this case, for this condition, is very helpful. So what we're going to do is, using that water bottle, we're first going to start by strengthening the bicep muscle, which runs this way in front of the joint. So we're going to take this kind of position with our feet. We're going to keep our elbow against our hip. We're going to keep our palm up, and we're simply going to do a simple bicep curl. 12 to 15 repetitions would be ideal. 2 sets. Now after you've done those, now we're going to target another muscle. We're going to target the tricep muscle, which runs behind the elbow joint to the shoulder. So we're going to hold your water bottle in the upright position. We're going to tilt our body forward slightly, not to hurt our back. You could engage your core here too. And what you're going to do is, keeping your elbow at your hip, you're going to make sure that cap's on really tight, and you're going to pour that water to the floor. Extending your forearm and feeling a nice squeeze in the tricep muscle at the top. And again, doing 12 to 15 of these, 2 sets. So that completes the sequence of what we would suggest for home stretching, resisted strengthening against your own weight, or with a water bottle or resistance band.
Applying the heater ice is actually very important in the acute phases, okay? So that completes our little seminar series on the elbow today. Hopefully you guys found it beneficial. If you found these exercises to be helpful, we can also send them to you through our PhysiTrax platform, which we can email right to your account. Again, if you guys have acute pain or any serious type of injuries, please call us at the clinic. Join us next week as we move up the body to the shoulder. We'll be dealing with the shoulder injuries that you may be dealing with at home. Hopefully give you a few tips to help you feel better at home, okay? So everybody stay well, and we'll see you next week.
Take care, everybody. Thanks for watching.